I'm Dr. William Lee, and if you've been ignoring this one sign, please don't close this video, because what looks like a simple stomach problem, what millions of people brush off every single day as stress or bad food or just getting older, could actually be your body desperately trying to warn you about something far more serious growing silently inside you right now. Colon cancer just became the #1 cause of cancer death in people between the ages of 20 and 49, not in elderly patients, not in people who felt sick, in young, active people who thought they were fine. Cases in people under 55 have literally doubled in the last few decades. And here's the number that keeps me up at night as a physician, 49. When we catch this cancer early, survival is 91%. When we miss it, when we ignore the signs, when we assume it's nothing, that number collapses to just 13%. So stay with me for the next few minutes, because I'm going to walk you through the exact warning signs your body sends you, signs so subtle that most people live with them for months without ever connecting the dots. And by the end of this video, you'll know exactly what to watch for, what to take seriously, and what could genuinely save your life. Let's start with something happening to you right now that you may have already explained away: a change in your bowel habits, not one rough morning, not a bad week. I mean a persistent shift that has been going on for more than a few weeks: chronic diarrhea, chronic constipation, or that strange unsettling pattern where you're swinging back and forth between both. Most people blame stress. Most people blame their diet. And most of the time, they're right. But your colon controls how water is absorbed and how stool is formed, and when a tumor starts growing inside it, that process gets disrupted. The growth irritates the bowel lining, it speeds up digestion, it creates blockages, and that back and forth pattern between diarrhea and constipation, that can mean something inside the colon is intermittently blocking the passage of waste. If this has been happening to you for more than a few weeks, please don't keep explaining it away. Get it checked. Now here's one that genuinely shocks people when I tell them. You step on the scale and the number keeps going down, and you haven't changed a single thing. No new diet, no extra exercise, no obvious reason. This is what doctors call unexplained weight loss, and it is one of the most important warning signs in all of medicine. Colon cancer steals your nutrition in two ways. First, the tumor physically interferes with how your intestine absorbs what you eat. But second, and this is the part that fascinates and frightens me as a physician, the cancer releases chemical signals called cytokines that actually hijack your body's own systems and redirect your nutrients away from you to feed its own growth. Your body is being robbed from the inside, and you feel it as fatigue, as weakness, as weight, just quietly disappearing. If you're losing weight and you don't know why, that is not something to monitor. That is something to investigate immediately. Now let's talk about the sign that people notice, panic about briefly, and then talk themselves out of taking seriously. Blood in the stool, bright red blood in the toilet, on the paper, mixed in with the stool. I know what you're thinking: hemorrhoids. And honestly, most of the time, you'd be right. Hemorrhoids are incredibly common. So is a condition called diverticulosis, where small pouches form in the intestinal walls and bleed. But here is what I need you to understand. You cannot look at that blood and decide you already know the answer. You are not qualified to make that call, and neither am I without an examination. Any unexplained bleeding from your bowel needs to be evaluated by a doctor, not next month, now. Here's a version of that same sign that's even easier to miss: dark or black stools. Not bright red, black and tarry, almost like motor oil. This happens when blood originates higher up in the digestive tract, your stomach, your small intestine, and by the time it passes through, digestive enzymes have darkened it completely. But it can also come from the right side of your colon. So if you notice your stool has turned unusually dark and you haven't been taking iron supplements or eating a lot of dark foods, do not wait. That is a same-day phone call to your doctor. Now this next one is the sneakiest sign of all, because it doesn't look like a bowel problem at all. It looks like exhaustion. You go to your doctor feeling tired all the time, maybe a little short of breath, maybe just dragging through every day. They run routine blood work and find that your iron is low, iron deficiency, anemia. Most of the time in women, this is explained by heavy menstrual periods. Most of the time, the answer is dietary. But if you are a man with low iron and no explanation, or a woman with no obvious cause, colon cancer has to be ruled out, because some tumors bleed so slowly and so steadily that you never see a single drop of blood. No dramatic moment, just a quiet internal bleed week after week, quietly draining your iron stores until your body simply cannot make enough healthy red blood cells anymore. The cancer has been there the whole time. You just couldn't see it. Here is one that gets dismissed probably more than any other sign on this list. That nagging feeling after a bowel movement that you're still not done, like something is still sitting there, like you need to go again. Doctors call this tenesmus, this constant frustrating urge to empty your bowels even when there is nothing left. People live with this for months, assuming it's IBS, assuming it's anxiety, assuming their gut is just sensitive. But when a tumor grows in the lower colon or the rectum, it presses against the bowel wall and recreates that exact feeling, your nervous system being fooled into thinking stool is present when it's actually a mass. If this has been your reality for several weeks, it is worth a conversation with your doctor. And then there is persistent bloating and gas. I know everyone bloats. Everyone has gas. This is not what I'm talking about. I'm talking about bloating that has no explanation, that hasn't changed despite no changes in your diet, that's been there for weeks. A tumor growing in the colon can trap gas behind a partial blockage. It can disrupt the delicate balance of bacteria in your gut, causing abnormal fermentation. It can slow the movement of waste, giving bacteria more time to produce gas. When bloating becomes persistent and unexplained, it belongs on your symptom list, not your list of things to just live with. Now, I want to tell you something that might be the most important thing I say in this entire video. The most common early sign of colon cancer is absolutely nothing. No pain, no blood, no change in anything. You feel completely normal while something grows quietly inside you. This is why I'm so aggressive about screening with my patients, because the best time to find colon cancer is when you have no symptoms at all. In the United States, screening should start at 45 for people at average risk. But if you have Crohn's disease or ulcerative colitis earlier, if a parent or sibling was diagnosed with colon cancer, start at 40 or 10 years before their diagnosis age, whichever comes first. If your father was diagnosed at 42, your screening should begin at 32. Your doctor will help you determine the right timeline for your situation. For screening, the gold standard is a colonoscopy. A flexible camera examines your entire colon, and if polyps are found, they are removed on the spot. Same procedure, same visit. The preparation the day before is not a pleasant evening. I won't pretend otherwise, but it is one uncomfortable night against the possibility of catching something that could take your life. If you're not ready for a colonoscopy, stool-based tests done at home can check for blood or abnormal DNA markers. They're non-invasive, they need to be repeated more frequently, and they are not as sensitive as a colonoscopy for catching early polyps. But they are infinitely better than nothing. I'm Dr. William Lee. In my next video, I'm going to show you exactly what is driving this explosion of colon cancer in young people and the specific changes you can make right now to dramatically lower your risk. Subscribe so you don't miss it. And if this video made you think of someone, a friend, a family member, a person you love who's been brushing off symptoms, share it with them, because the conversation you start today might be the one that saves their life.